Hey mama, you're listening to Coach the Mother, where postpartum recovery gets real, raw, and deeply rooted in who we are. I'm Dr. Natalie Forsell. I'm a virtual pelvic floor PT and postpartum recovery coach, and a mama who's walked through grief, healing, and the long road back to herself. Around here, we're rewriting the outdated narratives around birth and the body. We're demystifying healing, reclaiming strength, and giving modern moms the wisdom they should have been handed from the start. I'm so excited to continue this conversation today around why the 6-week checkup is failing us moms. Today we're tackling a critical issue. We are going to talk about the inadequacy of the standard 6-week postpartum checkup as we explore maternal health rate statistics and pelvic rehab stats here in America compared to other countries around the world, while we also talk about how we can improve postpartum care, not just for ourselves, but for moms we love around us. I can't wait to chat about this. To get started, we are just going to talk about maternal health in the US as it regards globally to maternal health stats, but then also more specifically around pelvic floor dysfunction and how many moms actually get pelvic floor PT. Spoiler alert, these are really sad stats, mama, so hang in there. But when we talk about maternal health statistics in general, there are many articles that you'll probably find that name this as a maternal health crisis. And here's why I agree with this. When it comes to maternal health statistics, specifically around deaths, these often are preventable deaths, and that's what makes them a crisis, because America is one of the leading countries in maternal mortality rates when it comes to, as compared to other high-income countries. I am going to pull up some of this data, and I will link it in the show notes below. So this first article can be found on the Commonwealth Fund, and this is more recent data that is post-pandemic, so from 2022 and on. The long of it short, America has some of the highest maternal mortality rates, and over 80% of these are likely preventable, aka here is why they call it a crisis. And we are comparing this information to other high-income countries that include Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, and the United Kingdom, also including Chile, Japan, and Korea. In the US, we have approximately 22 maternal deaths for every 100,000 live births, and these mortality rates are lowest for Asian Americans and highest for Black women. Other countries, like I've mentioned, that have the lowest maternal mortality rates include Switzerland with 1.2 per every 100,000 live births. Sweden is 2.6, the Netherlands 2.8. A lot of these countries are under 10, and then the US takes the cake for our maternal mortality rates being highest, above 13 for every 100,000 in US Asian Americans, and over 49 per 100,000 live births for Black women in America. These numbers are kind of crazy. Let's drop back to 80% of them are likely preventable. Now, this might have a direct correlation to the US and Canada having the lowest supply of midwives and OBGYNs across the board. We know when you go into a highly saturated and dense population area, there are just less doctors per birthing women. If our midwives and OBs are overstaffed, overworked, many of our experiences can get dropped through the cracks. How many of you have gone into an OB visit? You wait in the waiting room for 30 minutes to an hour, and you see your doctor for 5 minutes, 10 if you're lucky. You pee in a cup, you get into your exam room, you wait a little bit more, you maybe get a little ultrasound, and then you have time to answer one question, but they don't feel very invested or warm or like they're ready to sit with you. while you volcano all of your thoughts, feelings, and questions to them, right? There's just not the time for that. How often do you walk out of an OB appointment and you're like, oh my gosh, I had this list of all these questions I wanted to ask and I just totally got overwhelmed and I asked none of them and now I have to wait another month before I come back. That is such a common experience. The slowness and the attention to detail that midwifery model of care offers is so beautiful. I remember sitting with my midwife. She would come to my home and I could spend an hour and a half with her every single visit if I wanted to. She would sit and hold space with me, ask me how I was feeling through all of the spaces, physically, emotionally, spiritually. And so between each appointment, I felt like I was truly and deeply cared for. But if you listen to my last episode, the amount of women that give birth outside of a hospital setting are 1%. So there are not many midwives doing that with women. And this is the bird's eye view through the lens of maternal mortality. I'm not a practitioner that solves this problem. I am a pelvic floor PT and now a virtual coach. But if we view the problem from the top down, we can start to see how our non-life-threatening conditions or questions slip through the cracks if we are already slipping through the cracks on a large scale from this maternal health crisis in our country. Now, if we trickle down from that level of care into pelvic floor health and pelvic floor statistics, it honestly is equally as grim. This article through the NIH through Stat Pearls was published last August 2024. This article tells us that approximately 24 to 45% of women report urinary incontinence. Among women aged 20 to 39, it can be upward of 37% that experience some degree of incontinence. So that's about 1 in 3 women that you know having a baby, maybe even before, struggling with incontinence. In another article by Mayo Clinic, they pull up data from the European Spine Journal in 2004 saying at least 45% of women report some pelvic girdle or lower lumbar pain during pregnancy, and 48% of women reporting some type of strain on their pelvic floor. Up to 7% of these cases would describe it as disabling. So on the spectrum of symptoms, 7% call it disabling in terms of back pain or pelvic floor pain during pregnancy. That means 93% of women don't feel like it is disabling, but they still have symptoms. I'm sure almost every mom listening to this can think of some type of ache and pain they had in their pregnancy and they just dealt with it because they had no idea that someone, a pelvic floor PT could help with some of these symptoms. Back pain, pelvic floor discomfort, pubic symphysis pain, leaking during and or after pregnancy. And the previous article from the NIH I just mentioned only speaks to incontinence, but we also know in our postpartum journey how many other symptoms can crop up related to the body changes that we feel in pregnancy, whether that is carpal tunnel, neck and shoulder pain from carrying babies all the time, baby wearing, holding, nursing, or lower back pain from a really weak core that can't stabilize your spine, so you're in all of these weird postures for long periods of time. I could just go down the body before I even get to the pelvic floor of all the things you can feel. I couldn't find any research that from a global perspective accounts for any type of symptom a postpartum mom can have in relation to the body changes they go through from top to bottom, but I guarantee that it is probably a lot higher than 45%, which speaks to how many women possibly deal with incontinence. It's clear from our personal experience how much we struggle with all of these unnamed symptoms, how many women in the United States actually get help, how many women actually go to a pelvic floor PT. Also, this question is also really hard to answer because there's not a lot of research, and that is not surprising at all. But from the one that I could find, an article also through the NIH, this article is titled Retrospective Claims Analysis of Physical Therapy Utilization Among Women with Stress or Mixed Incontinence. The average age of a study subject in this article was 50 and a half years old. And this noted women with these types of incontinence. And this article notes that of women reporting these types of incontinence, only 2.6% had at least one PT visit within 2 years following their diagnosis. And of those 2% of women who saw a PT, only 21% of them had more than 8 visits. When it comes to, again, just handling leaking, less than 3% of women get help with this issue. How many people go to a pelvic floor PT or a physical therapist in general after they give birth? Likely it is just as low. I also know that there are about 4 million women who give birth in the country annually, and there are about 5,000 pelvic floor PTs in the country. If you do the math, I would have to see around 800 women a year to serve them all. And yes, I believe that all women should and could benefit from pelvic floor PT after birth. But that is physically impossible. I don't even know how many people a month that would be, but there are just not enough of us, let alone the awareness of how this type of service could help moms. It's just not very present. That is one of the many missions of this podcast. Here to educate you. So, mini recap. In America, from the top down, the U.S. holds the highest mortality rate for moms who give birth in the world compared to high-income countries. We also know that the U.S. and Canada have the lowest supply of midwives and OBs, especially midwives in our country, compared to other high-income countries. We learned in this last podcast where the 6-week checkup even came from. So if you think about how overstaffed and overworked our OBs and midwives are in our country, how we get one little checkup and then are sent on our merry way without really taking into account just how valuable pelvic floor PT and referrals for mental health can be to support the mom. Plus, layering on that probably about half of the women or more in the country who give birth are struggling from some type of symptom in their body postpartum and could benefit from some rehab or professional support, to how less than 3% of women actually probably get help with anything they're dealing with. I would like to stack that against what some other countries are doing well compared to America and how we could learn from them. One country I would love to applaud is France. New mothers are routinely prescribed 10 sessions of pelvic floor rehab out the gate, and it's covered by their national health insurance. This is a proactive approach where every single mother is given this avenue of care, and it helps in preventing long-term pelvic floor issues and overall problems. Other countries like the Netherlands and Belgium incorporate into their birthing plan a postpartum plan that starts to be formed around the 34th week and incorporates community midwifery support and structured postpartum care, whether that is referrals for other providers. But I wonder what that would be like if around 34 weeks you weren't just planning with your providers, your midwives, and your OB about the birth itself and how to get through the labor and delivery. What if we also talked about the postpartum plan, where the structure and support is going to be in place and how you will feel cared for as a new mom? There are many other countries around the world where postpartum care is integral to their community. It may or may not include pelvic floor PT, but places like China, Morocco, Nigeria, Australia even have these postnatal periods of anywhere between 15 to 40 days long, and they involve a lot of different hands on the mother, whether that's providing meal, having doula care, having abdominal wrapping, providing nourishing meals, families to help the mom support her caring for the baby so she does not have to lift a finger or leave her house. All she has to focus on is taking care of this newborn. Whether that directly impacts the mom's back pain and pelvic floor leaking, I can't exactly say, but I can imagine if as a mother I was given this kind of bubble to rest and nourish and heal from, how would that change me moving outside of that initial newborn phase into my postpartum journey when it comes to healing and recovery and regaining strength? I can only imagine that it would be a bit more supportive than how we feel in America. The US is also the only high-income country where there is no federally mandated paid leave policy. I don't think this is news to any of us. I think we all know this and feel this deeply in our souls. However, if we tie it into the bigger picture, we, from the top down, don't have enough midwives or OBs. We don't have any paid family leave. Then we're left to kind of fend for ourselves. We don't have many resources or referrals to pelvic floor PTs because there's just not enough of us in the country. All of this leaves so many moms who slip through the cracks. And then this pervasive narrative that whatever we're feeling in our body is just the way that it is. I put air quotes up there. And it's just how we need to deal with this phase of motherhood. You have back pain, that's normal, you just got to deal with it. You have leaking, everybody does it, and we'll laugh about it, but secretly we're really embarrassed and wished it would stop. Or we have neck and shoulder pain constantly. I know, at least for myself and so many clients that I've had, when they start with me, the narrative that is deeply embedded into their brain and bodies, whether or not they say it out loud, is this feeling that giving birth is the beginning of the end of our youth. If you just sit with that for a second and you've already had kids, maybe one or multiple, there is this kind of wondering of what is going to be normal for me now. Am I ever going to feel like my core is strong again? Is my booty just going to be flat like a pancake from here on out? Will I always have back pain and neck pain? Will it ever get better? And if I just keep having more babies, will this get worse? That's kind of what we sit with privately to ourselves. And then outwardly, we normalize all of these issues that we have. This all connects back to the bigger system issues, but then that 6-week checkup. We, in so many ways, can acknowledge that there is a little bit of lack of trust in our medical model or medical systems, but when you go into your OB's office and you present a concern and they very confidently dismiss it or give you no resources on how to move forward or tell you if the problem gets worse, maybe you'll just need a prolapse surgery. Doctors can talk with such confidence and conviction that despite what our intuition is telling us or what information we've learned to rub against that status quo, we end up letting it go or second guessing ourselves or just diminishing our concerns because we were told otherwise from OBs, from family, from friends. I know from my own personal story, I have been a pelvic floor PT since before I had kids, and once I became a mother, it completely changed my mindset around how I help moms. Before I was a mother, I just was very linear about diagnosis and treatment, but then after I became a mother, I start to really see the whole person and how from head to toe, what can we look at that really helps a mom feel better in her body outside of not peeing her pants anymore or having back pain. Two very important things, but we are not just compartmentalized into these areas of our body. I really learned the hard way from having a lot of problems myself how much help I needed and how there was almost no avenue to take care of myself all in one place. Let alone, I didn't really think much about the relationship with a patient and an OB when I was not yet a mom, or that 6-week checkup. It wasn't a big factor of my care. But now I feel so passionate about it because when I did go through my first birth and went to my OB, I had no idea what to expect, honestly, but I went in there with a handful of questions that I would like some either direction on or a referral that she recommended, or just to see how she would respond, honestly, to my questions. And that is where it hit me of, oh my gosh, all she did was not even put a finger in, but she lifted up the sheet that was draped over me and looked around a little bit, made sure that the stitch was gone and there was no bleeding, and then said, do you have any questions for me? And I did. And then she dismissed a lot of them and said, you're cleared for sex and exercise as long as there's no more excessive bleeding, this, that, and the other. And I just remember feeling dumbfounded that a woman who was, and this was a woman provider, she was all up in my business through this birth, and then after birth there was no checking, and that was it. That was all. Having done a lot of pelvic floor exams by that point myself, I at least thought there would be some type of hands-on assessment, which there weren't. And I imagine there are some OBs that do a little bit more investigating with their patients than mine did. That's the point that really changed the way I practice and now why I'm doing virtual care. That moment opened my eyes to, if I knew so much about the body and I was even dismissed and felt alone and unsure about what to do next, how many women who have no experience, no doctorate, no pelvic floor or perinatal clinical training have so many questions that get left unanswered, or maybe just language they don't even have to ask the question. Whenever I start to talk to new clients and they're trying to describe some of the symptoms they have, it's really hard for them to describe, A, because that's just a very vulnerable area of their body and it's embarrassing to talk about, or B, they are trying to describe things that they don't quite have words for, whether it's like prolapse and bulging, or it's difficult to describe where and when their symptoms arise. They can't quite connect any of the pieces together. The 6-week checkup does not mean anything. If there's one thing you learned from this podcast, the 6-week checkup does not mean anything. And if you have more questions, there are people out there to give you answers. Hello, that's why I'm here. What can you do for yourself? Advocating for comprehensive care, encouraging your healthcare providers to adopt more of a holistic approach, including pelvic floor PT. If you are pregnant and you have not come to the birth and the 6-week checkup yet, then ask them if they have any pelvic floor PTs on their referral list and what that looks like for them. If they don't, then that is not a good sign. And seek information for yourself. Educate yourself. Seek information about postpartum recovery, what pelvic floor health looks like after birth. Share this podcast with as many moms as you can, because there'll be so much more coming on this channel. And if you, again, are currently pregnant, you can consider enrolling in programs that offer comprehensive postpartum support that address both the physical and emotional well-being as you enter into this phase of motherhood. If you are already a mom and you are 1 to 2 years postpartum, it is never too late for you to tend to your symptoms and reach out for postpartum rehab support. Ideally, I would love to work with every mom. They get signed off on their fake 6-week checkup. They are cleared and they would come right to me. They would get started, and within just a few months, they would feel like a completely new person. But more often than not, it takes moms months to years before they're ready to finally tune into their bodies and take care of them. That's a whole nother podcast episode about why I think it takes moms that long. But it is ultimately never too late. You can always make improvement. You can get out of pain, heal your core, your pelvic floor, and regain your strength at any time after you give birth. My virtual program, my Postpartum Recovery Program, is designed to fill in the gaps left by the traditional 6-week checkup. The Postpartum Recovery Program is a 4-month program that offers holistic care from your home without clinic visits, without coordinating childcare or bringing your baby to an office setting. You can use all of these tools with minimal equipment and minimal space in your house. This 4-month program walks you through my 4-phase recovery system that is highly research-backed and made to fit your busy mom life. The foundation of the program is movement, because if I give you some Kegels and some stretches to do, that will not change anything. Through pregnancy and postpartum, our body really goes through so many changes. We lose so much muscle mass, our abs get stretched out, and it's all interconnected. Your core, your pelvic floor, your breathing mechanics, your diaphragm, your glute strength, your posture. So this foundation of movement are quick and efficient workouts that you're given 3 times a week, and they are short. They are 15 to 30 minutes long, because I know mom life is so crazy, especially with a newborn. You might only have a 10 to 15 minute window to do anything for yourself in general. And those are also often competing with other things like cleaning the house or washing your hair or drinking some coffee. I don't know. But knowing that your life is so busy, I make a really simple to follow workout program that changes every phase of the system to purposefully scaffold your healing and your strength building, while we also give you a custom recovery tool belt around whatever symptoms and issues you're dealing with. If that's leaking, back pain, carpal tunnel, literally whatever you're feeling in your body, we figure that out on our first call together. And then I help build a toolkit around what your body needs to help reduce and eliminate these symptoms. Once a month, we have a check-in call where we go over in detail, how is your program going? What are some tweaks we need to make? How are you progressing? Where are you getting stuck? What are some barriers in your life? How are you doing, mom? Again, this holistic approach that is not just around the physical pieces, but the emotional and relational pieces, so that you can feel the most supported and get the most out of this program. Then we have weekly check-ins that are quick voice notes or texting to make sure that you're on track. And I'm also available to you when you need it. You don't have to wait a week or a month to ask me a question. If you have a back spasm flare-up, you can text me that day and I can ask you some questions, give you the tools that you need to nip it in the bud immediately. So instead of that pain or that issue lasting weeks to months, it can be gone in a matter of days. The system that I've developed helps my moms get better faster than any clinic setting I've worked in, because it is on your time and you are in the driver's seat. The framework is simple to follow. It is easy to plug into your day. It's not a printout of exercises that you forget about or you lose in your diaper bag. All you have to do is log into your client portal. You can pull up whatever video you want to go through and I guide you through it. The accountability and support factor also really helps my moms stay consistent much more than they do in a clinic setting, because we have a direct line of connection to each other. And last but not least, like one of these articles said earlier, less than 3% of women go to pelvic floor PT in general. Less than half of those women get more than 4 visits. Less than 30% of those women go to more than 8 sessions. So the consistency of this program, the 4-month roadmap that walks you through a healing system, and the ease of which you can implement this into your life that doesn't require you to drive around town or 30 minutes one way to get to an hour-long appointment, makes this program so much more doable for moms and actually gets them from pain and dysfunction to being able to do what they want to do. Do you want to go back to CrossFit without fear of hurting yourself or leaking all over? Do you want to be able to run and play hard with your family? Do you want to go back to running half marathons? Whatever it is, this gets you from where you're at now to where you want to go in such a faster time frame. If you want to learn more about my Postpartum Recovery Program, you can find the link to my website below that gives you every detail you ever need, and you can apply straight to the program from the website. You can also DM me on Instagram with any questions that you have. And I'm excited for this next episode, part 3 of why the 6-week checkup is a failure to us moms.